Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you are ready for liftoff. We are live now.
Well, I feel so fortunate and lucky today on Planetary Health First, Mars Next. This is Michael. I'm the host, producer, dishwasher, whatever you want to say. This is my little thing, and it's still going. We're not going to go to Mars yet because there's plenty of stuff on Earth and planet Earth. But today we're really excited. We got a special friend guest, Gil Bashe, formerly with Finn Partners, but involved with so many great things in healthcare.
Still with Finn Partners, my friend. Still with Finn Partners.
No. I said formerly with Finn Partners, but you
formally,
have
not formally. I got it. You absolutely.
Yeah, no, officially, officially, no. Yeah, we don't. Oh gosh, that is not how we want to. Nothing to like. So no, that's why
Michael Mann has breaking news for Gil Bashe. Whoa.
So that's why language is so important. You might not want to text conversations all the time because nuance, meaning. So Gil, give us just a quick backdrop with who you are, a little bit about yourself, please.
Yeah, thank you, Michael. First of all, just about your own introduction, I just want to say to our viewers today that Michael has the opportunity to speak to countless people in the course of the year, and one of the great advantages that he has that I admire is by speaking to so many people with great perspective, he gets smarter and smarter. So while he's the host of this program, he's probably one of the sharpest people in the industry in terms of tapping into what's hot, what's happening on this planet, which is the only planet we have right now. We better take good care of it and take good care of ourselves so we can stand on it. No, thank you, Michael. I'm very privileged. This is, I think, the third time I've had the opportunity to be on the program, and it means a lot to me because I know so many people are vying for these slots, and to be invited back a third time is very, very precious. When we're beginning a career, we sometimes don't, we don't think in terms of the projected future of how it all connects and makes an impact. I've been very blessed to work with some of the smartest people in our industry, clients, of course, colleagues, of course, many leaders of the non-governmental organization sector around the world. And much like you and the connection you have with your guests on the program, I've been blessed because those people actually leave a little bit of knowledge with me each time we rub shoulders. So just to bring the viewers up to date, my earliest career actually was going to be involved in my graduate studies in water management. And now obviously this dates back quite a few years before sustainability and environment, climate change were mega super hot topics. But I just saw water as one of the most precious and enduring qualities or quantities, assets that the planet has. So I actually studied that in terms of how it impacts geopolitical relations way back in the 1970s. From there, I was privileged to work in an NGO dealing with regional peace in the Middle East. It's hard to believe right now we could even say those words, but it remains possible. I actually was sent to Egypt after Sadat went to Jerusalem, the dramatic travel that he made to change the face of the Middle East. I had the chance to go to Cairo and meet with some of the Egyptian leaders who were advocating for peace. And then from there, I actually journeyed into the health sector. And it really captured my imagination and my passion. And I realized I wanted to make that a lifelong career. I've had obviously opportunities to work within the government sector, to create agencies, to lead agencies. It's a privilege to be a leader within Finn Partners, dealing both with global health and with purpose and social impact. It includes environment, sustainability, climate, of course, climate technology. And I've had stints in between where I've also worked in large private equity. So all of those career steps have actually added to my connections and my knowledge. I'm very, very fortunate. It's given me great perspective of how policy and money and people influence our collective destiny.
I'm glad I let you speak and not do a bio read, because I loved how you started with the water, and it's sort of full circle, and then the different pockets that you've had really help me understand better of you as this friendship evolves, sort of who you are and what motivates you, and really gives you that perspective I'm hearing from that career experience through the journeys of different sectors. Really, we are all benefiting from your fruits of your labor and your experience. So thank you, Gil. And
I think it's a little bit also, Michael, like, what are you going to do when you grow up on my end? I'm still trying to figure that out, thank God, because I think one of the things that keeps me fresh and adventurous is I'm purpose and challenge driven. Some people are title driven. I'm looking around the corner trying to figure out how we, you and me and others, we solve pressing public health and planetary health problems, and that allows me to sort of take risks, and say, what else could I be doing that is meaningful for me and meaningful to others?
Well, I know before we started, we were in the green room, or whatever room we tell it, backstage, and you were sharing you were working on an article that's going to be released or already released, and it kind of ties to, I mean, I was just kind of doing your predictions of 2024 healthcare predictions, but it's really what you were more of a issues. So maybe we should start with just the predictions and then move on to the issues that you're kind of tying into. So what are your predictions in 2024 in healthcare? I know people would love to hear that.
Yeah, thank you, Michael. And I read a lot of people's great writings. There's people I know. John Nosta has written some great pieces, and Evan Kirstel, and Joe, and many people so from the counseling standpoint, the thinking standpoint, have written trends and predictions. Obviously, on everybody's list, not on my list, I might add, not on my list, not because it's not hot, but I'm looking at other issues. I'm looking at issues. But everybody, of course, is writing about AI and Gen AI, and that's a transformative technology, no doubt about it, hands down. And I've written about innovations that people should watch in the past. I wrote a piece a few months ago, very, very popular, of the top 20 people in AI to follow. And I'm glad to see that many of those people have lived up to my expectation. They are really people to follow, and people are starting to realize I need to follow them. For instance, I included the number 2 person at OpenAI. She was relatively unknown. She was tapped as the temporary CEO of OpenAI when there was that whole sort of chaos swirl between OpenAI, its board, and Microsoft. She rose to the fore as I think a very stabilizing factor. So many of those types of people appeared on my list. AI is not on my list because it's been covered too much. But there are things on my list that I think are critical issues that we really have to center around. And if we don't center on those issues, we don't really appreciate how transformative innovation and technology can play its largest role, or not. So what I focused on actually is something a little different. I wanted to play around with, focus on what I think will be the big policy and legislative issues, 10 top issues that are going to keep members of Congress, both on the federal and the state level and the administrative level, up at night, and should be keeping, I think, our industry, biopharma, most certainly medical device, medical diagnostics, digital health. I thought that they needed to focus on the issues, because too often I think we're kind of obsessed, enchanted with the innovation. But we have to understand that all this innovation is really designed to deal with problems. So I actually started to look at the problems, the issues that I think people should educate themselves around, and that those issues would kind of guide their perspective around the changes we can expect. So let me give you an example. I think is going to be and I put them in alphabetical order, by the way, because it's hard to predict which is like the big issue. It's not like the top grossing movies of 2023 or expected to gross in 2024. These are issues. So some of the issues I looked at was, for instance, the issue of access. Now that sounds like common, but when you look at access, we're dealing with not just general access, we're dealing with access through the lens of the Inflation Reduction Act of 2022, how that's going to influence our perspective around access. For instance, insulin, that no American's going to spend more than $35 a month for insulin. That's a big game changer. That's a big game changer. But I kind of allude to the fact that making insulin available for $35 a month is phenomenal. It is phenomenal. Big problem. Why are we getting an explosion where so many people need insulin? Big issue, sickness, right? We have a sick care system instead of a health care system. That's a problem. So on one hand, we're making medicines more accessible, fantastic. On the other hand, we're not dealing with the core issues of why we need those medicines in the first place: disease, preventive care. And so I went back and forth and said, guess what? For every issue we try to find a fix for, we've got to be prepared. We're going to break something. And what frightens me often, as I say in my preface to this top 10 list, is that in looking at the issues, I think we have to stop thinking about how we penalize or punitive toward innovators for inventing things that cost money, and start pulling together to realize that those innovations, ideally, if deployed earlier, could actually start saving us money. So I looked also at the issue of affordability. And I approached the issue of, for instance, it's not just the making things accessible, it's making them affordable. I did touch on what you and I spoke about earlier, climate change and health. We tend to think of climate as, boy, I hope that the mall I go into has air conditioning, but it's bigger than that. The United States Southwest had some of the hottest temperatures ever in the history of this nation. I think, if I'm not mistaken, the thermometer breached 115 degrees Fahrenheit in the Southwest, and there were numerous heat-related deaths in Arizona and New Mexico, something we've never experienced before as a nation. So clearly, climate change in health is related. Now, we as you and I have discussed before, this planet doesn't need people, but people need the planet. I think we have to start to recognize and stop debating climate change as an issue and recognize it is an issue, and we need to engage and recognize that if we don't start to reduce our carbon impact on the planet, we're going to see a lot more people admitted to ERs regarding heat stroke, dehydration, heart attack, all related to climate. I looked at data security, cybersecurity. We still don't have a system in this country that patients can readily access their data and share their own health data from institution to institution. You can get into your portal, but you can't necessarily move these data from one portal to another portal. And then guess what? One of the most breached systems of information systems in this country, guess what? Hospital systems. Hospital systems are constantly being hacked, and their data is being held ransom, and they're having to deal with getting their data back. We can't progress in terms of digital health technologies unless we deal with cybersecurity aspects. So innovation and cybersecurity are one and the same. Drug equality, sort of like dealing with drug access and equality. It's not just about making medicines accessible and affordable. It's actually dealing with the equitable access of the medications. And I want to give you an example. Some people that you and I may know could live 2 hours from a tertiary care center. Think about it. They live 2 hours away from a community-based health system. but they live 15 minutes away from a pharmacist. I think we have to recognize that we have about 25% of this country, 25% of this country that live in rural America. They don't live next to a hospital. They may have diabetes. They may have a low level of heart disease, high cholesterol, blood pressure, and so forth. Can we train and empower pharmacists? Most people live, believe it or not, even in rural Americas, half an hour away from a pharmacy. Can we authorize, just like we authorize pharmacists today to handle vaccination at the pharmacy retail level, can we also train and authorize pharmacists to serve in some cases as primary care providers of continuity of care, instead of requiring people to make a 3-hour drive to see a physician? So I list that as a basic sort of low-level shift that I think we have to consider in making the health system more equitable. Problem? Health worker burnout is a big issue. We have to ask the fact that 14% of respondents of a recent survey said they're leaving medicine altogether. 14% of people were surveyed in a recent survey. I think we're going to lose about 250,000 healthcare professionals from the system very soon. So people talk about AI as being a big sort of panacea to improve care. Problem, you know what hospital systems say when they see, wow, we're going to make care more efficient? They say, and doctors can spend more time seeing more patients in the course of the day. So right now they're limited. If you're a specialist, you get to spend about 16 minutes with a patient. If you're not a specialist, you can spend about 9 minutes with a patient. Well, let's say you've got a patient who's looking at a potential serious operation or cancer. Should an oncologist or a surgeon only be able to spend 16 minutes with a patient who's distraught and upset or has a lot of questions? I mean, think about that. Mm-hmm. Is that what people go into medicine for? So this concept of healthcare burnout is a real problem. Mm-hmm. When we think about the fact that technology isn't being seen to make health delivery more effective or specific, precise. Mm-hmm. It's actually making health workers look like they're on the manufacturing line, and patients are the widgets they're manufacturing. Mm-hmm. It's not going to work. It's not going to work, and we're going to lose more and more people going into this. Now, it's also tied, believe it or not, to the fact that we've got a sort of a boomer explosion about to happen. So we have a whole generation of boomers who are reaching that mid-70s level, another wave right behind them. For the first time in this nation's history, we have a negative birth rate, a serious negative birth rate. At the same time, we're not letting skilled workers from other countries into this country. So historically, it's not just the tech worker, it's the medical worker. If you notice, you see fewer physicians and nurses from Southeast Asia who were once let into our country to sort of like amplify or add to the system. They're out. They were told, go home. Visa revoked under the last presidential administration. Well, we're about to have a problem. And I don't think that doctors and nurses are going to stand for it. And I think as a result of that, we're going to suffer. Innovation vulnerabilities was another one of my issues that I looked at. I think the underbelly of innovation is threatened in this country. This country actually is driven on innovation. I think it's very possible that innovation is going to start to shift, particularly in the area of technological innovation, digital information innovation. I think it's going to start to shift toward India. Why? Scale of population, increased education, a growing middle class. And we're going to see probably more US-based innovation shift to other countries that can compete with us. Now, on one hand, the legislative body wants to tamp down on what they call the generics issue, which is pay for play. They call it pay for play. Problem is, many big generics companies target innovator patents and threaten them so that they can say the patent is going to be revoked. And innovators, to get them off their case, strike deals with those generic companies and say, we'll let you enter the marketplace 6 months earlier, and we'll give you an opportunity to manufacture some of our product, back off. Congress sees that as restricting the ability of generics to enter the marketplace. Innovators say, hey, we've got billions at stake. Yeah, we don't want to risk a court case where we might lose the billions. Congress has to look at this sensibly. It can't just protect the generic industry and then leave the innovation industry vulnerable. So, yes, it has to clarify, which is protected under our Constitution, patents, the right to own a patent. What does that mean? And it has to also give the generic companies the ability to enter the marketplace. It's not one or the other. That's what I said, fix one thing, break another. Let's not fix one thing and break another. The other aspect is biosimilars. Biosimilars are not generic biotechs. They're similar products. They were expected to reduce the cost of biologics. They haven't. Why? There's a huge amount of hurdles that these companies have to go through. And as a result of that, by the time they get into the marketplace, they're pretty much charging a bit less than, but almost the same as the originator products. So we really haven't fixed the cost of biologics in this country or the developed world. We've kind of traded one problem for another problem. I think that we realize now that biosimilars really need to be made by companies that know what they're doing. And we need to set a clear pathway that doesn't make it so difficult for those products to enter the marketplace, while again giving some leeway to protect the innovators. It's not one or the other. The next thing I really wanted to talk about is mental health. During COVID, it became very permitted to speak about mental health conditions. And the reason for that is suddenly people saw their own children, teenagers, youngsters, impacted by the isolation. We started to talk about suicidal ideation, suicidal risk. We started to look at teenage suicide, college-age suicide, and so forth. It reached really epidemic proportions. And we also sort of came into this field understanding how digital health and telehealth could help. We really have to continue that trend, and we have to realize that there's physical health. In other words, there's physical, biological health, and then there's emotional, mental health. And mental health is a serious medical condition. It used to be if someone had a child at home who was struggling with emotional well-being or mental health, people were concerned about that, right? We have to continue to see the stigmatization of mental health as an illness unto itself. We've got to liberate families, adults and children, parents, from that burden and recognize that mental health happens. Also with seniors. I think that the Chris Dodd from Connecticut was on CNN just last week talking about the fact that we have a mental health crisis in this country on loneliness with senior citizens. They have nobody. They have no one to spend holidays with because people move around, families move around. Sometimes seniors can't move around. They can't travel. And so we're facing mental health challenges at all levels. That's a problem. We're going to have to engage. We can't escape it. And I think that we have to continue to innovate, both in terms of the quality of medications and innovations, and most importantly, diagnostics. Pandemic readiness. We kind of want to forget that we totally boggled COVID-19 in terms of communication, in terms of explaining what a vaccine does, what an inoculation does. We use terminology that murky the waters. We made COVID-19 into a political issue, a blue and red issue. It's not. It is a public health issue. It is not a political issue. And we are not ready for the next pandemic. And by the way, it will happen. It will happen just as Ebola happened. And just as bird flu happened and as COVID happened, the next thing will happen. And I don't think that we've really readied ourselves. I think we've swept it under the rug. I think we wish that we could forget about how we really boggled the COVID-19 communications effort, rollout effort, and societal mobilization effort. I think we under-equipped our senior care facilities. We under-equipped our frontline health staff. They were vulnerable. And I think that it's like sending out our defenders, our people who defend our country, and not giving them the equipment necessary to defend themselves. It was tragic. It was absolutely tragic. And last on my list is telehealth. We could say, well, it's a given, Gil. Why is it still an issue for you? Well, guess what? I think we have to divide and set policy of when an in-office visit is truly needed and when a telehealth visit is really effective and efficient for many different reasons. One of the key reasons I think we have to do it is we have to improve access to care. It's that circle I started with, access to care. Telehealth makes care more accessible, and it encourages people who have concerns to engage the system early before small problems become big problems. Problem, a lot of doctors come on in. I want to have you in my office because I prescribe this medication and I have to have you come in. I think we have to push much more for telehealth, for the patient's convenience, for throughput purposes, and also, if I might add, the environment. When people go to see their doctor, more often than not, they get in their car and they drive to their doctor. They drive 15 minutes, they drive 1 hour. Makes no difference. We're contributing to the carbon footprint of our planet. Telehealth reduces that emission problem. And so I really do think when we get there, telehealth is not just about access to care. It's not just about ensuring people in rural America have access to exceptional care. It's not just ensuring that people who are elderly have good access to care. It's ensuring that our planet also will have good access to our consideration for its care. And so the last on my list was telehealth as an issue. We've got to do a lot more with it. We've got to be much more expansive. And we shouldn't be talking about this as a policy of permitting or not permitting telehealth. We should be looking at how we expand it. So Michael, those were the top 10 issues that I looked at. And I looked at them from the lens of I'm not going to deny it. I looked at the lens through the lens of cost. Mm-hmm. I think cost to us emotionally, the cost to us economically, and oh yes, the cost to our sustainability.
This was great. And I liked how you broke up these topics. And when I look at the theme, I see that we have a structure, especially like with telehealth, that is just not efficient and effective. I think of Amazon, just plug and play and you order it and comes. And that's really how our healthcare system should be, regardless. It shouldn't even be telehealth, right? It should just be healthcare, asynchronized, synchronized, however it be. And you like 90 or 80% of it, you don't need to see a doc in the thing. And it's tough because I feel it from the provider side. They've done their thing. They don't have enough investment in order to reimagine, redesign, but it really needs to be there at some point. Yeah. And when that,
you're spot on. I mean, you're spot on because Amazon. I had the privilege of interviewing the Amazon medical directors from Amazon and One Medical. They invited me to meet with them during health, and it was a real privilege, and I thank them for that. I wrote an article that appears on Medical Life, very popular, and Amazon is doing this, I think, one of the best ways possible. They're doing it constructively. They're learning from the One Medical experience, and they're studying how their consumer-focused system could improve health access. And I think what you just said was so astute that we need, whether it's Amazon and One Medical doing it exceptionally well, or an Amazon-like mindset to health access and affordability, to improve our well-being, our satisfaction with the health system. I really love your analogy there about mentioning Amazon, because I don't think that the health system of this country or many countries is actually patient-centric at all. I think it's system-centric. I think that the patient is a bother. It's like almost like the system is saying, our system would work so much better if it weren't for those damn consumers. And yet it's supposed to deliver for us. It's supposed to deliver for us. And yet everything is set up so that it becomes
it's comical. I mean, you go to the doctors, you had the visit, and you're like, well, can I get an appointment in 6 months? Well, you need to call back in 5.5 months because we don't have a calendar that goes out that far.
Absolutely. My wife was telling me that she was trying to schedule something for her mother, my 91-year-old mother-in-law, and she usually scheduled it 6 months in advance, to your point, like this visit to the next visit. And they called her up and said, I'm sorry, we can only schedule 3 months in advance. Well, why didn't,
I hear from a doctor, I think they don't have a template that goes out beyond six months. Like they don't. And then the other thing is you often have to call the day of, because only, I don't know, the percentage of appointments that are missed, no-shows are high. So the pediatric office that we take our daughter to, they're always like, well, you need to call at 8:01 the next day, the same day. I mean, it's but anyway, I think I would be curious to know if you've heard anything. I don't want to be like naming out companies and this and that, but I'm curious to see how Costco might be doing it with Sesame Health, their telehealth. I imagine that might be pretty good.
Yeah, they've launched this service. Look, I think that we need this. I think that the health system needs some traditional, what I'll call new approach competition. And I think that the reason we need the new approach competition is that Costco or Amazon are very customer centric. They're and I think that they're going to break through in a way that we need them right now. What this country has lost is this primary care system. Now, we still have primary care doctors, thank God. They're working very hard. But the reality is, even if you have a primary care physician relationship, if you have a pressing problem, probably, and you don't have to answer this, probably you're going to look and say, well, there's a MedEmerge, a walk-in clinic, 10 minutes from my house, and there's another one 12 minutes from my house. I'll call up and see who has the shortest wait, and I'll go there to ask them about this rash. And so they're interested in resolving that problem for you. They're not interested in your total health. They're interested in that part of your experience of them. And as a result of that, many Americans are relying on that sort of like convenience-based system to handle their basic health needs. And they're no longer doing blood tests, for instance. We don't know their cholesterol. We don't know their white blood cell count. We don't know their A1C. We essentially don't know a snapshot of their health any longer until they get super sick. And then obviously they go into the sick care system. But the healthcare system, which is designed to be part of the primary care setting, that's disintegrating in this country. And that should worry us. So yeah, Costco, Amazon, I think that they could shake up the system, and maybe the system needs to be shook.
I also think the younger population, as the demographic shifts, this whole doctor relationship is going to change based on the consumer. It's just a matter of when, the time. But I think there is something about the trust that could be done, and maybe value-based care can redesign the way the payment is, the way the experience is. I'm hoping that could be a help to accelerate more of that experience. What are your thoughts on that?
Boy, I'll tell you, many Americans change their health plan because of cost factors. Either their employer changes it or they change it every 3 to 5 years. And what happens is you get a big book from your health plan. How many people really read the big book of benefits? Nobody, right? It's a bump into the system plan, which means, I need this. and you get to the ER, with heaven forbid, with your child because they fell off their bicycle, and then you find out what your coverage is, and you make a decision on the spot. We have no standards. We have no standards in this country, so there's many different reasons why we need 3 or 4 shows to discuss that. But it's a wild west. Our healthcare system is truly the wild, wacky west of health systems. It's fragmented. It's hard to navigate. It's hard to understand. No wonder why people sort of say, "Hey, I'm going to go to a walk-in clinic. It's as easy. It's easy peasy, right? They take a copay. They solve my problem. I'm out of here." So yeah, I think, Michael, you're raising the aspect of the consumer experience of health. Makes me feel, I haven't published my article yet. It's being published tomorrow, but
you can add one. You can add one.
No, I only want 10, but I have to really think through if I want to swap out one now after this.
Hey, maybe 12. I like the number 12. That's one of my favorite numbers. We can get you one and split, and we can figure out another one in the next few minutes and add 12. Why not?
Yeah. I could say everybody's writing about AI in top 10. I didn't want to do that. So I didn't write about AI, and I have 11. So there you go.
Yeah, I love it. I love it. Well, tell us, man, you're all over the place. You're in so many publications. You're involved in so many different things. I think people would love to know what's on your radar for conferences or meetups. What tell us about that for 2024?
First of all, I love being with our community. We have our health community is magnificent and is really looking at how we change the dial. So there's some meetings that are on my constant radar screen. I enjoy them. I enjoy the people who go there. They inspire me. I learn from them. I write about them. So next up is Vive. Vive is going to be in LA. It's a relatively new conference. I went there for the first time in Nashville last year. I rank it very highly, so I'll be at Vive. Then I'm moving on to HIMSS. HIMSS is exceptional, and I highly recommend HIMSS. That's the health information community. It's quite large. It gets 30,000 plus people. And health information really is the foundation of the health system, how we move information, assess information, scrape information, deploy information. So HIMSS is on my calendar as one of my must attend. After that is Health Without Vowels. I've had a mixed relationship personally, emotionally, not because of Health Without Vowels, but because of my perspective. I've really started to lean into it. I kind of understand what to expect from health now. And I tend to sit actually there in the press room, meeting with people and writing stories. I think the bulk of my time is meeting with industry colleagues and looking for really hot stories to report from that meeting particularly. But there are, I would say, and I'm also looking at Health Europe this year that will be held in Amsterdam. I've sort of a great fan of the team that's putting that together. I think it will be a great meeting. There are some other meetings though that I take very seriously that I think should be on people's radar screen. They're well attended. They're off the radar screen, but they're really, I think, critical to the health innovation industry. CNS Summit, number 1 on that list. It is curated by Dr. Amir Kalali. And Dr. Kalali really is one of the great ambassadors for the life science sector. He curates this meeting very, very carefully. Some of the sharpest people of our industry attend. It's unscripted. Most of it is fireside chats, and you really get into the hearts and souls of the people who are leading the health innovation industry. CNS Summit. It doesn't stand for Central Nervous System. Collaborate, not for novel solutions. Next is the Gallion Foundation's Gallion Summit. It's held in New York every year in the fall, usually September, October. It is founded and curated by Monsieur Bruno Cohen. He's from Paris. He's a visionary. He brings together a summit with pretty much all of the CEOs and leaders CEOs of the major life science companies, and also leaders of the major NGOs of the world. They come into New York to the Alexandria Life Science Center. There are only 400 seats. Book now and early. It's an incredible off-the-record, unscripted conversation of CEOs up on stage, telling it as it is. You get to hear Ken Frazier, Alex Gorsky, people like that talk about pricing, talk about access, some of the things that did influence my top 10 list. No, honestly, I won't deny that. Look for that. They're actually starting the Gallion Summit in India this year. I'm very excited about that. I'm very privileged to be one of the judges for 2 categories. I actually am judging in a new category dealing with climate innovation, climate and environmental innovation. Very, very privileged to be part of that. And I'm also a judge on the incubator, accelerator, and private equity category. Again, very proud to join with some global leaders in that category. And my last meeting that I look at, because I think it's the future of drug innovation, is a meeting called DTRA.org. It stands for the Decentralized Trials Research Alliance. And I'm really enchanted with that meeting because it's one of the few places where I go where industry and government sit together as partners and talk about some of the critical issues, obstacles in dealing with drug development, the role of technology, the role of dealing with racial equity, people who are normally not in clinical trials, who should be invited to participate in clinical trials, gender equity. All of these things are discussed there openly between industry and government and patient communities. And it's about time we created a collaborative forum where people could discuss this openly. You have to either become a private member or your company has to be a member to attend. And I made the leap as a private member. It's an investment in my knowledge. I buy zillions of books. I certainly would shell out $500 to become a private member and sit there and learn from the assembly. So I think a 2.5-day meeting. So that's definitely on my radar screen this year. There are other meetings that I highly recommend. If you're involved in oncology or diabetes or heart disease, I recommend go to AHA, American Heart Association scientific sessions, or the American Diabetes Association meeting. All of those meetings I think are really mission critical if you're therapeutic category. By the way, also the American Telemedicine Association, ATA, led by Anne Mond. I think she is brilliant, and I think that that's a meeting to go to. I've enjoyed. I just didn't go to it this year. Maybe I'll go back. But those are the conferences on the radar screen.
And that's really great that you ended with the Tele Association, because that was one of your biggest issues and concerns. And I imagine that conference is all about accelerating and moving it forward.
Chock filled with policy issues.
Good.
A lot of government people are there. A lot of industry people are there. Again, very collaborative forum, and I'm very grateful that they do that.
Gil, I feel like we've done a lot today. I feel like you've really given us some really amazing topics, and I look forward to putting this out there, getting make sure we get your article out there too when we post this on the newsletter. We'll do that as well. So as reference points. I really appreciate it. I consider you not only a friend, but a mentor, just really someone. I think Gil starts with a G, but you are a guiding light. Really, you're a great person. And I hope we can keep it up. And I just thank you so much for being here today.
Well, Michael, back at you. You are one of the most thoughtful, kind, knowledgeable hosts for a health-oriented podcast. You know this material so well, and you bring out the best in your guests. So on the behalf of all the people who you host on the program and myself, I want to thank you. I want to thank you for everything you've done for our community in 2023. and everything that you intend with great heart to do for us in 2024. And to your listeners, the many listeners, thank you so much for supporting Michael in this journey. It's a must-followed endeavor.
Thank you so much, Gil.
Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.